composite laser vision correction, it's not really a painful experience. The most uncomfortable thing about the whole process is just that at the beginning of the procedure I put a freezing drop in. To date, there's no freezing medication that doesn't sting, so there's a few seconds of stinging from such medication. Beyond that, you may or may not feel a slight pressure. There'll be something, obviously, to hold your eyelid out of the way. I can't do it through the closed eyelid. And if you squeeze very hard with the other eye, you might feel a slight pressure from that something holding your eyelid open. The laser itself is done with a contact lens docking onto the eye. The contact lens is curved, so there is minimal pressure. Not enough to somehow affect your vision, and generally people don't feel that at all. And when the little sliver of tissue, which we call a lenticule, is removed, you may or may not feel a slight pressure at that point in time, and most of the time you feel nothing. As such, that process is really no different than creating your flap with LASIK, and then lifting the flap, and if anything, it's at least as comfortable, if not more comfortable, than LASIK. In the past, the most common way at some point in the past was to perform laser vision correction through a process of PRK. That involved removing the self-replenishing surface layer, the epithelium, which had to regrow. Now, in the good old days, which weren't all that good, let's look at the non-flush toilet the great-grandparents might have had, the PRK was actually often quite a painful process and often had prolonged pain afterwards. Now, that does not necessarily apply to today's solutions. It certainly does not apply to LASIK or the SMILE procedure. And we not frequently will do PRK anymore. It's fairly rare that we do a PRK. There may be some circumstances whereby you may have had some form of laser vision correction some years in the past, and it may or may not be ideal to relift your flap. It may be that you need some fine-tuning, even after a procedure like SMILE. Now, we have different solutions for different fine-tunings after SMILE, some of which don't involve any laser at all and are completely atraumatic and non-invasive. But once in a while, there may be the condition whereby PRK will be the most appropriate thing to do. But with the advent of better healing bandage contact lenses afterwards, and eye drops as well as pain medications, there's really, in the post-operative period, very little difference in any discomfort between PRK and LASIK or SMILE in our experience. The main difference is that the PRK patients take a bit longer to heal and have better vision, and not on drops for significantly longer, and that is certainly a hassle, and that certain things that we can do with SMILE and LASIK we can't quite achieve with PRK because of that excessive healing response. But when it comes to fine-tuning and making a slight adjustment of a few numbers, then PRK is sometimes the most appropriate and the best solution, which doesn't need to create any huge fear because it's not a huge treatment that requires the risk of getting haze or anything else or have any significant discomfort.